Welcome to Raaonline. In today's session, we'll see about medial compartment of thigh. So these are the competency we are going to learn today. First is the describe the major muscles with their attachment. Attachment meaning it includes both origin and insertion, the nerve supply and action of medial compartment of thigh muscle. The second competency is describe origin, course, relation and branches or tributaries and termination of important vessels and nerves present in the medial compartment of thigh. We'll start with the introduction of thigh. The thigh is the region present between the hip and knee joint. So the thigh is divided into three compartments. So here you can see the skin and beneath that you can see the superficial fascia. So underneath the superficial fascia you can see the deep fascia here. So the modification of the deep fascia, namely the medial intramuscular septum. This is a lateral intramuscular septum and this is a posterior intramuscular septum. These three intramuscular septum divides the thigh into three compartments, namely anterior compartment, this is a posterior compartment and this is a medial compartment. So the muscles present in the anterior compartment will extend the leg at the knee joint. So in other words, this anterior compartment muscles are called extensor compartment. Similarly, the posterior compartment is also called hamstring muscles. These muscles flexes the leg at the knee joint. So these muscles are also called as flexor compartment. Now the topic of today's lecture is the medial compartment. See, the muscle present within this compartment are going to adduct the thigh at the hip joint. So these muscles are present between the medial intramuscular septum and posterior intramuscular septum. Actually, this medial intramuscular septum is not that well defined. Because of this, the facial plane between the anterior and medial compartment is not well established except in the upper thigh. The three compartments of the thigh is communicated with the trunk by means of three routes. The anterior compartment communicates with the abdominal cavity through the space between the inguinal ligament and pubic bone. So through this gap only the femoral vessels and nerves enters the anterior compartment of thigh region. Similarly, the pelvic cavity is communicated with the medial compartment of thigh through the obturator canal. So through this canal only obturator vessels and nerves enters the thigh region. Similarly, the posterior compartment is continuous with the gluteal region above. The major structures passing between these two region is the sciatic nerve. Now we'll see the medial compartment of thigh proper. So the muscles present in the medial compartment are, first is the gracilis, pectineus and three adductor muscles, namely adductor longus, adductor brevis and adductor magnus. These adductor group of muscles are called riders muscles. The main nerve supplying this medial compartment of thigh is obturator nerve. Apart from this obturator nerve, the femoral nerve also supplies the pectineus. The sciatic nerve, the tibial component also supplies the adductor magnus. The action of all these muscles are mainly adduction of the thigh. The blood supply, the artery supplying this medial compartment is Profunda femoris artery, which is also called artery of adductors. Apart from this Profunda femoris, the medial circumflex femoral and obturator arteries also contribute to the blood supply of this compartment. So we'll see the muscles first. So the muscles of the medial compartment of thigh are arranged in three layers. The superficial layer, after removing the skin, superficial fascia and deep fascia, we can see from medial to lateral, the long muscle which is present, medialmost muscle is the gracilis. Little lateral to that you can see the adductor longus and lateral to that adductor longus is the pectineus muscle. So from medial to lateral, gracilis, adductor longus and pectineus muscle forms the superficial layer of this compartment. Between the pectineus and adductor longus, you can see the adductor brevis, which is forming the middle layer of the medial compartment. And just deeper to these two layers, you can see the adductor magnus, which is forming the deeper layer of this compartment. When you see this picture, all these muscles are crossing the hip joint, whereas only the gracilis is crossing the knee joint. So, apart from these 5 muscles which are present in the medial compartment, there is one more muscle present within this region, that is the obturator externus muscle. Though this muscle is described here, this is not a adductor muscle. This is one of the pelvic muscle. So, this is a picture familiar for you. So, we have studied this with the femoral triangle. So, this is a sartorius and this is the iliopsoas and this is a pectineus. So, the pectineus muscle forms the floor of the femoral triangle and this is a adductor longus and this is a gracilis muscle. So, these 3 muscles forms a superficial layer of the medial compartment. And the next middle layer is formed by the adductor brevis. So, in this picture you can see this is adductor brevis. Just above this you can see the obturator externus muscle, which is one of the pelvic muscle in relation to outer surface of the obturator membrane. So, this muscle is explained here because this is lying in plane with the adductor brevis, and the deeper muscle seen here is the adductor magnus muscle. So, the action of these muscles are mainly the adduction of thigh at hip joint. But remember, in lower limb all the muscle act in 2 ways, when the foot is on the ground or off the ground. When the foot is on the ground, these muscle acts from below, thereby balancing the trunk on the lower limb during walking. So, in addition to this adduction movement, the medial rotators are adductor longus and adductor magnus, whereas the obturator externus will do the lateral rotator movement.